young pretty girl with us. She's got a very unfortunate thing, you can say. Born with a cleft palate. She's had 3 surgeries before. So I'm going to show you her current palate situation. So you can see there's a soft tissue that's attaching the uvula. I'm going to show you that. So you see there's a tissue, this part. So they've done a pharyngoplasty because you can see the palate is attached to the pharynx. Then if you look up, there's a small hole there. There's a tiny hole here. But most important thing is, when she says ha, the uvula and the soft palate needs to move like this in. It's not moving. Right. Now, I'm going to tell you a little bit more about what we've done for her. So this is her lateral video fluoroscopy. Now, lateral video fluoroscopy is a technique which is done in the cath lab, wherein we're able to find out the exact location of the muscle of the soft palate and the uvula occluding on the pharynx. Pharynx is the posterior wall of the throat, and this is a soft palate. It needs to go and occlude. Once this happens, this movement necessitates, or it's required, or it's mandated so that we speak clearly. Now she has a severe nasality because this doesn't happen, right? Now why is it not happening? In her case, the muscles are not approximated, are not in the right position, and therefore, even if you have multiple speech therapy sessions, even if you have any other procedure, it's not going to work unless you put these muscles in the right place. Now, this condition is called as velopharyngeal incompetence. Velum refers to the soft palate. Pharynx is the posterior part, or the back part of the throat. Incompetence refers to the fact that it's not working well. It's incompetent. It's not competent. So we could correct this VPI, or velopharyngeal incompetence, into a velopharyngeal competence. That's the goal of this speech surgery that we're planning for her. So it's essentially going to be for the muscles on the soft palate, muscles on the uvula. At the same time, I'm going to close that small hole, that small fistula that is there. I'm not going to be detaching the pharyngeal flap that has been done for her before. She's also had a buccal flap inserted there several years ago. All of this were her secondary and tertiary procedures, all done in different other Indian cities. So I got to keep in mind that it's a lot of scarring. So we have to make sure that the procedure is done very finely, just moving the part of the muscles more posteriorly, more inferiorly, meaning it needs to go more up and more back so that the competence can be achieved. So the plan for us to do the surgery, I don't know when they have the time, maybe in the next few weeks. And then after that, we will be putting her on speech therapy after a month. And that might go on for maybe 2 months or 3 months. And by the end of this, I'm going to be expecting significant improvement in her speech. Nida Pesvia? Okay, so you can listen to her speak something now. Can you tell us your name, please?
Kanyakumari.
Okay, 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8.
Okay, நீ பேசுற வேலை மற்றவங்களுக்கு வந்து என்ன டவுட்டா இருக்கு கேட்கறது?
Understand ஆகுதுல்ல sometimes.
Difficulty இருக்கு. மூக்லோடி பேசுறேன்னு சொல்றாங்களா? Okay,
சேத்தனான்றதே வந்து சேத்தனான்ற மாதிரி வரும்.
so nasality ஜாஸ்தி இருக்கு. Okay, இதுக்கு முன்னாடி 3வது ஆபரேஷன் பண்ண பிறகு உங்களுக்கு இம்ப்ரூவ்மென்ட் கொஞ்சமா தெரிஞ்சதா இல்ல இம்ப்ரூவ்மென்ட் தெரியாம அப்படியே இருக்குதா?
Improvement
தெரியல. So I just asked her if she felt any improvements after her secondary and tertiary surgeries that she got done elsewhere, and she says no, unfortunately she didn't see any improvement. And I really hope and trust and that this surgery we're going to plan for her. She's going to get good improvement. We're going to try and make her come back to us, though she lives in a nearby city, doesn't live here with us in our city. But still, we hope to give you a feedback or a follow-up of what's going to happen in the next few months.
Thank
Yeah?
Okay.
Thank you.